Hi, I'm Bob Comator from the law firm of Levy, Phillips & Koenigsberg, and we're very pleased to have with us today Dr. Harvey Pass, the Chief of Thoracic Surgery at NYU Medical Center and a specialist in mesothelioma and lung cancer. Now, this may be a tough question, but why do you think mesothelioma is so hard to find a cure for?
Well, I think that there's a number of issues. I think it is a rare tumor, so there are not many individuals who really concentrate on the disease. I concentrate on mesothelioma, but also concentrate on lung cancer. I also have access to tissue on both, so it makes it easier for me. Second, it's not that type of tumor that really is out there. Breast cancer obviously has a tremendous advocacy group, has always had an advocacy group. We have MARF, and they do such a great job. But even for 2,500 people, one organization, it would be nice to have others. But MARF does an incredible job. Finally, if you have something that's only 2,500 and you don't have a lot of investigators, then you can't get the resources from the federal government with regard to research dollars to be able to do the type of research that needs to be done. It's getting better. It's getting better through the advocacy of MARF. It's getting better through the advocacy of...
MARF, for those who don't know the acronym, is the Meso Foundation, or
Correct.
Mesothelioma Foundation.
And to be able to have organizations such as the Department of Defense that now has targeted money for it, is terrific and is novel and absolutely tremendous. But if you compare the amount of funding that's for that disease and the amount of dollars that it costs with regard to all the other things that you're involved with, you know, if we found a way to cure the disease, if we spent the money in the right direction, either find the disease earlier, all those late costs of caring for the patients that cost so much when it's late stage disease would be then converted to maybe minimizing the disease in early stages so that the patients would live longer, and it becomes a disease of chronic illness, so that you keep the patients in a steady state without the disease advancing. That's going to save money in the long run. It's just a matter that it's very difficult to convince certain organizations of the importance of that.
Yes, and because of the limited number of people that have the disease, I think that's part of the problem. The Department of Defense you raise is a good source, because a lot of people who served in the military, in the Navy, were exposed to asbestos, and so a lot of veterans do come down with this disease because of just what they did in the Navy and so forth. And so the Department of Defense is a perfect source of funding. One would not expect it, but that's a perfect source.
Absolutely, and I must admit though that there is a change in the wind. In other words, okay, who are the other people that really are at risk? Well, it's the hard-working laborers that are plumbers, insulators, electricians, the people who do the jobs that our life, it makes it easy, but they're represented by unions. And what is very gratifying is that unions now are very attuned to the risk of this. Unions are now becoming more interested in devoting resources to be able to look to having their groups that they represent participate in the sort of research that's necessary to find, say, the disease earlier. And so that's another, it's almost like a volunteerism of the unions that is needed. It goes along with the idea of philanthropy. That's very important for this disease also.
Yep.
And so any source of funding that then can be shared among investigators, which is another problem. The ability to get investigators to work together so that you can share tissue, somebody can be researching this aspect of it, this aspect, and it's all the same tissue.
Well, that's the beauty of the tissue bank and that.
So that you can all work together, and that's slowly coming around. People are now putting in what's called spores. special programs of research excellent, that's from the National Cancer Institute, for mesothelioma, which is terrific, in which you have institutions working together trying to use the resources from the NCI as well as from their own universities to try to find how to solve this disease.